mental toxicity, physical symptoms. The mind-body connection. When psychological trauma remains unsettled, it can trigger deep-seated psychological concerns. According to Dr. Gabor Maté, a specialist on addiction, individuals frequently fight with wounds in the past, particularly during their childhood years. These psychological wounds generally continue to adversely affect them throughout their lives. Although this can be difficult to properly figure out through medical research study, this makes sense intuitively. When a terrible experience is determined and ultimately challenged, people can experience drastic improvements in their lives, supporting the concept that trauma has unfavorable effects. However, when it comes to physical disease, we often think a strictly material causality. With the knowledge and tools, medical professionals can find out which microbe or deficiency has actually triggered your disease. Nevertheless, some studies are checking out the concept that psychological injury can also cause the manifestation of physical health problem. While many people associate significant life events with trauma such as sexual or physical abuse or seeing combat, in reality, it is typically a lot more subtle than this. Even relatively less significant events can leave a lasting impression on an individual. Psychologist Dawson Church, PhD, provides a more detailed definition of a traumatizing occasion. She lays out 4 crucial elements. 1. It is perceived as a danger to the person's physical survival. 2. It overwhelms their coping capacity, producing a sense of powerlessness. 3. It produces a sensation of seclusion and aloneness. And 4. It breaks their expectations. Lissa Rankin, MD, spoke about how a link is formed between this kind of injury and the symptom of physical illness later on in life. She explained that psychological changes can ultimately cause physical changes. Rankin elaborated that you're not just picturing being sick. You're physically ill. However, the physical symptoms you're experiencing might be due to unhealed injury, and the stress, anxiety, and depression that manifests is that which makes you susceptible to physical illnesses. In Rankin's book, Mind Over Medicine, Scientific Proof That You Can Heal Yourself, Rankin likewise discussed the concern in depth. She pointed out a study that shows a connection between trauma and particular health problems. The 1990 research study, where Kaiser Permanente in the U.S. Centers for Disease Control, CDC, collaborated on the Adverse Childhood Experiences study to monitor 17,421 patients, paved the way to more than 50 peer-reviewed scientific posts. In the study, clients were interviewed to recognize whether they had actually experienced any of these 10 traumatizing occasions in youth. Emotional abuse, emotional neglect, a household mental disorder, home drug abuse, incarceration of a household member, a mother treated badly, adult separation or divorce, physical abuse, having been overlooked or ignored, and sexual abuse. The outcomes of the research study revealed that many people experience youth occasions that distressed them, and at least 2/3 of the participants went through one traumatizing youth occasion. The findings were then compared with the physical health of the interviewed clients, and researchers found a dose response. These shocking youth events were connected to adult illness in all classifications: cancer, heart illness, chronic discomfort, autoimmune illness, bone fractures, high blood pressure, obesity, diabetes, depression, smoking, and suicide. The average age of clients in the study was 57 years of age, proof that youth injury might have a postponed result on the body. An event from 50 years ago might ultimately trigger a health problem today, and the more adverse childhood events a person reported, the sicker and more resistant to treatment they were. This study is an amazing reason to start taking our mental and physical health more seriously.